We begin with the story all new at 5 o'clock. The flu causing some concern this year. Officials saying the U.S. is at its highest level of respiratory illness since at least the 1997-98 flu season. What you see here shows how the flu cases have changed from last May. In that time, they've counted well over 80,000 cases. Again, this is nationwide, and well, we're still in the thick of the season. And one secondary effect from all of these cases is a big strain on hospitals around the country. Lincoln has well over 10 medical centers, and one of them says they're feeling the pinch. Good evening, everyone. Thank you so much for joining us on this Tuesday. I'm Rod Fowler. Local doctors saying more patients are coming through their doors than usual. And tonight, our Karen LaCresse tells us what they're seeing firsthand and the message they want the community to hear. Karen?
Yeah, good evening, Rod. Doctors tell me this flu season isn't just about high numbers. It's about who's getting sick and how quickly symptoms can escalate. Inside hospitals, they're seeing more patients, and that could be putting a strain already on busy staff. At Bryan Medical Center, doctors say they've seen a noticeable spike in flu cases over just the past 2 weeks. On Tuesday alone, 7 patients are hospitalized with the flu. Just 1 week ago, that number was 4, and before that, there were 0.
But we are seeing some co-infections, quite a few. I took care of a couple patients last week that had both COVID and influenza.
Inside hospitals this winter, doctors say beds are filling a little faster than they expected. Health officials say while the flu can feel routine, symptoms vary for different people.
Many, it is just a respiratory infection or a cold, but for many, it can be life-threatening. There's death across the country in both young and olds.
Doctors say the surge is impacting not just patients, but the healthcare workers caring for them.
If we're full of folks with COVID and influenza, what does that do? Or how are we able to help the other patients that come in with a heart attack or a stroke or other infections that we need to be treating?
And a reminder, doctors say this flu season isn't over, and awareness can help protect both patients and the people caring for them.
Obviously, vaccination is always the right answer for influenza, COVID. It is not too late to get vaccinated for influenza.
Now, Dr. Klaus says this surge happens every year, but so far it's not as bad as the 2024-2025 flu season. But she says with school coming back into session this week, she is anticipating another spike in cases. In the studio, Karen LaCresse, Channel 8 News.